Hello and welcome. My name is Jessica Bennett and this is my reflection for HAS 350 on modules 9 to 11, Children and Young People, Cultural Determinants and Public Health Policy. Firstly, I would like to acknowledge the traditional custodians of the land on which I live, work and learn. I pay my respect to elders past and present and I extend that respect to all Aboriginal and Torres Strait Islander people. As a non-Indigenous person, I recognise that it always was and always will be Aboriginal land. I acknowledge the deep spiritual and cultural connection that First Nations people have to this country. I want to say how lucky I feel to be able to take this subject and learn more about Indigenous culture and the disparities when it comes to the social determinants of health. So firstly, I will be discussing Module 9, which is Children and Young People. It is common knowledge that the foundations of adult health start in early childhood. It is important that children have adequate physical, social, emotional, and language development when growing up. Even before starting this subject, I knew the significant difference between Indigenous and non-Indigenous children when it comes to the social determinants of health. After watching the video from the CRE REACH program and its findings, and reading the article on the health and well-being of Indigenous adolescents, it has furthered my understanding of how all social determinants of health are interconnected and how these affect Indigenous children. The CRE video findings and the article go hand in hand with highlighting the importance of having all the social determinants of health met in childhood, as well as the importance of family relationships. And then looking at the graph on this slide, it shows the hospitalizations. So this is from the video. The hospitalizations of specific conditions, mainly related to abuse. And it's in the care of family, with contact with family and no contact with family. And it's clear in the numbers here that as the child had less contact and then no contact with the family, that the percentage of the abuse-related things that they were going through actually decreased. So I think that this video is something that everyone should be aware of because it highlights that having contact with the family is sometimes not what's best for the child, when I think it's pretty known that most people think that having contact with the family is the best thing. And then something that alarmed me when reading the article was the statistic that 80% of all deaths among Indigenous adolescents could be considered potentially avoidable within Australia's current health system, as well as the fact that 15 to 19-year-olds had rates of hospital separation due to assault and rates of childbirth that were 5 times those of non-Indigenous people of that age. This made me realise just how bad the Australian healthcare system is failing Indigenous youth, and made me question how statistics like this can even exist when we live in a developed country with an advanced and well-accessed healthcare system. The article also found that communicable diseases, especially sexually transmitted infections, are the leading contributors to morbidity amongst Indigenous youth. This made me reflect that this is more than just a health issue, that is a lack of education and access and culturally appropriate care. I assumed previously that sexual health education is a given in childhood education. However, this stat makes me question that. Indigenous youth clearly have a lack of access to sexual education in general, and probably even less access to sexual education that is culturally relevant and safe. This realisation highlighted the deep interconnectedness between the social determinants of education and health. A lack of access to education combined with systemic racism or mistrust in non-culturally safe institutions directly impacts health literacy and well-being of the Indigenous population. I'm wanting to work in the prison system with young people, hopefully as a youth officer, so being conscious of this will positively impact the tailored programs and help I will be providing, as unfortunately a lot of Indigenous youth are stuck in the cycle of the criminal justice system. I will ensure I advocate for health education programs that are tailored to Indigenous communities that highlight the clinical and cultural needs of young people. Next, I will be reflecting on Module 10's content, which looked at the cultural determinants. So when I was engaging with this week's content, it helped me view health and wellbeing not just through a Western lens. I hadn't actually been considering the crucial role that connection to land, language, and community plays for Indigenous people. The article by Finlay et al. Discusses how, despite Indigenous communities having constantly stated the importance of culture to their health and well-being, that Western medicines have been dismissing this, and then this leads to gaps in health policies and programs, unfortunately. And then when watching the video provided in this module, I was really paying attention to what Janine Muhammad was saying. And she allowed me to ignore this thought of Western medicine and provided me with insight into the positive impacts that can come with having a deep connection to culture, as well as addressing how important culture is to health and well-being of Indigenous people. She discussed how Indigenous Australians were actually 6 times less likely to get COVID than non-Indigenous Australians. This highlights how their culture and their ways of knowing have protected them from COVID, and further reinforces the importance of cultural practices when it comes to the health of Indigenous people. These insights further help to reflect that social determinants of health are not isolated factors, but are actually deeply interconnected with each other and other cultural determinants. For future work in the criminal justice system, I am committed to advocating for health initiatives and programs to be co-designed with Indigenous communities when working there. I will ensure that cultural determinants are not an afterthought, but an essential foundational element of initiatives and programs that are run. Lastly, I will be reflecting on Module 11, which looked at public health policy. So before engaging with this module, when I thought of policies like Close the Gap, I automatically thought they were doing good for the Indigenous population. However, when discussing the lecture notes and looking at the statistics, I was shocked of how many of these were actually not on track. The failures reinforce the importance of focusing on public health policy for Indigenous people. So looking at the 2 images that I have on the slide, you can see in the first one that there are only 2 on there that are actually on good improvement and are on track. So that's Born Healthy and Strong and Early Childhood Education. And then in the second one, you can see that there's only 1 that is in the category of good improvement and on track, and that is economic participation. The rest of them are either have some improvement but are not on track, worsening and are obviously not on track then, or no change from the baseline, or that there's no data available. So looking at these stats, you can see clear connections between social determinants of health. As you can see here, the child protection and child thriving is actually worsening. Then looking at the outcome number 14, which is social and emotional well-being, and outcome 10, which is criminal justice, which are both also worsening. These highlight the importance of early childhood experiences and the impact on social and emotional health and the chance of ending up in the criminal justice system, linking to what we were discussing earlier. Following on from this, the failure of the 2023 Australian Indigenous Voice referendum was disheartening and made me disappointed in our society. For me, it reinforced how structural inequalities and a lack of national recognition continue to undermine progress towards health equity for Indigenous people. It baffled me how there are clear disparities between Indigenous and non-Indigenous individuals when it comes to the social determinants of health. People still didn't want to give them an equal voice. The referendum may have been unsuccessful, but personally it motivates me to try and make a difference in any way that I can. In my future work, if I get the opportunity to work with Indigenous youth or adults, I'll be taking on board everything I've learned throughout this subject. I found it so interesting and helpful to see how the social determinants of health are interconnected, and I'm confident that this will assist me when I'm working in the future.